Hello and welcome to the BOBE OMTR Study Guide Lecture. This is Dr. Delcina Bean Burrows for the College of Natural Health Sciences, Bermuda. The Bermuda Osteopathic Manual Therapy Board Exam, the BOBE OMTR, is a 120 multiple choice question exam, 40 questions per section, which is designed to test your knowledge in three key areas: basic science, which is human anatomy, human physiology, and pathology; clinical science, which is osteopathic manual therapy practice; and clinical management skills, which is case management, osteopathic techniques, and documentation. You will have 3 hours to complete this exam. 2 10-minute breaks are provided within the time. The first break occurs after the first hour, and the second break occurs after the second hour. Please read each question carefully and mark your answer on the exam booklet. The passing mark for this exam is 450 out of a possible 600 points. Notification of exam results will occur within 2 weeks after the exam is written. Now, in terms of the exam taking strategies that we're going to recommend, well, we strongly recommend that you follow the below, or I should say the aforementioned exam taking strategies to ensure your success in passing the exam. The first, relax. You are more prepared than you think you are to pass this exam. 2, take advantage of the breaks when they occur. And 3, read and reread each question as much as possible, as much as you need to make sure that you understand the question. 4, complete the sections of the exam that you believe you are the strongest. So if you feel that you are not as strong in the anatomy and physiology, you can do that part of the exam last after you get through the other parts. And 5, take your time. The first section of the exam, which is the basic science, is based on anatomy, physiology, and pathology, and there will be 40 questions. The topics will cover things such as homeostasis, blood cells, connective tissue, the location of the spinal canal, the types of fractures, narcolepsy, nerve impulse transmission, body cavities, digestive system, endocrine system, lower extremity anatomy, cranial nerves, gas exchange structures, heart anatomy, digestive enzymes, and gonococcal cultures, just to name a few of the topics. And we strongly recommend, in terms of what to study, you're going to want to make sure that you go through your AAP 301 and 302 lecture notes from 1 all the way to 24. Also study your anatomy labeling practical assignment. This will help you in terms of remembering where the various anatomical structures of the body are located. In terms of section 2, clinical science, there will be 40 questions, and the topics will cover things such as philosophy, clinical reasoning, ethics, and holistic practice. You are advised to take a look at OPN 303, which is Principles of Osteopathic and Naturopathic Philosophies. Lectures 1 and 2 will be very instrumental in this part of the test. And so clinicians seminar lectures 3, 5, 6, 7, and 8 will also be things that you want to make sure you take a look at, really concentrate on those lectures in terms of studying for this part of the exam. Now, in terms of section 3 of the exam, clinical management skills, there are 40 questions, and the topics will be on case management, scope of practice, and osteopathic techniques and documentation. And for this section of the test, you want to make sure that you really go in and study OMT 400 lectures 1 and 2, clinician seminar lecture 24, and also this particular lecture study notes with respect to scope of practice, and we will go into that in the next few slides. So for this section of the study lecture, we will discuss the description and scope of the Level 1 OMTR. Let's first look at the description of an OMT. Osteopathic manual therapists, OMTs, are fully qualified professionals who use evidence-based, highly trained sense of touch and palpation to assess imbalances or dysfunctions within the body and facilitate the required techniques as appropriate for each individual. OMTs are educated to the Diploma, Associate of Applied Science, and/or the Bachelor of Science degree level. Level 1 OMTs can only refer to themselves as osteopathic manual therapists and not osteopaths or manual osteopaths because their scope of practice is not as broad as osteopaths or manual osteopaths, whose training goes beyond the bachelor degree level. Level 1 OMTs are usually qualified professionals in other disciplines such as massage therapy, personal training, physical therapy, occupational therapy, and exercise physiology. Level 1 OMTRs are registered with local regulatory agencies or associations. They comply with the association's published Code of Ethics and Conduct, and they carry malpractice insurance as well as practice within the well-defined scope of osteopathic manual therapy. So let's take a look at what a Level 1 OMTR scope of practice, what that is. First of all, a Level 1 OMTR will perform client history taking through client interview, health questionnaire, medical records review, and health team collaboration or consultation. They will perform a thorough osteopathic musculoskeletal assessment or evaluation, which will include range of motion, manual muscle testing, symmetry observation, deep tendon reflexes, sensation, postural analysis, special tests such as Patrick's, Homans, and Tinel sign, as well as be able to perform vital signs. OMTRs will also be able to identify musculoskeletal conditions and abnormalities, which is a clinical diagnosis or clinical impressions. They will be able to devise a treatment plan or a plan of care according to the client's condition, existing diagnosis if known, and osteopathic assessment findings. They will use direct and indirect osteopathic manual therapy techniques to address conditions and abnormalities such as soft tissue therapy, myofascial release technique, muscle energy techniques, joint mobilization, still technique, facilitated positional release technique, lymphatic drainage techniques, strain counter-strain techniques, balanced ligamentous tension technique, and combined osteopathic techniques. They will also be able to blend osteopathic techniques with other therapeutic techniques as indicated, such as proprioceptive nerve facilitation, PNF, neurodevelopmental treatments, which is abbreviated NDT, deep tissue massage, Swedish massage, reflexology, and acupressure. The Level 1 OMT will also be able to provide treatment in accordance to a physician or osteopath or doctor of physical therapy, doctor of occupational therapy, or doctor of chiropractic referral. They will be able to provide general advice regarding proper body mechanics, joint protection, and energy conservation. They will also be able to provide general advice regarding healthy lifestyle choices, such as they can advise their clients to stay hydrated and to eat a healthy diet. They can advise their client to try to maintain a healthy weight or BMI, body mass index. They can advise their client to quit smoking if they do smoke. They can caution their clients about alcohol consumption. They can also encourage their client to obtain regular exercise. They can encourage their clients to try to manage stress if that is an issue. They can also advise their client to get between 7 to 8 hours of sleep every night. And they can ask or advise their clients to maintain a healthy work, rest, play balance. And the level 1 OMT will be able to refer clients to specialists for care that is outside the scope of OMT practice. They can make recommendations for medical intervention, such as sending the client back to their GP when necessary. The level 1 OMT can submit claims for health insurance reimbursement, and the level 1 OMT can maintain and secure the client's records for at least 10 years after discharge. So now that we've discussed what is within the scope and the description of what an OMT is, let's now look at what is outside the scope of a level 1 OMT practitioner. So the very first thing is that an OMT will not provide a medical diagnosis of any kind. They will be able to give clinical impressions or a clinical diagnosis based on what they're seeing, but not a medical one. This is also true for manual osteopaths and osteopaths in any case. They will also not be able to use high velocity low amplitude thrust techniques, HVLAT, and they will not be able to use spinal manipulation techniques. They are not able to devise a comprehensive therapeutic home exercise program. They can give limited advice on certain kinds of exercises that can be done in the home, but for the most part, OMTs will not give you a comprehensive therapeutic home exercise program because their training does not go into enough depth in order for them to do that. But they can give some very limited advice with respect to certain kinds of things that can be done in the home in terms of therapeutic exercise. But therapeutic exercise from a comprehensive standpoint for the purposes of developing a home program is not within the scope of a level 1 OMT. Also, a level 1 OMT is not able to devise a clinical dietary program, and this is also true for manual osteopaths and regular osteopaths unless they have been specifically trained in that area and they are operating as a dual professional. And the most important thing is that a level 1 OMT, as well as manual osteopaths and regular osteopaths, are not able to provide any kind of advice about prescription or over-the-counter medication, nutritional supplements, and or herbal remedies unless they are specifically trained in that area and they hold a dual certification, or in some cases a triple certification. But within the scope of OMT practice, this is not something that they are able to do. So now that we've gone over the scope and what is outside the scope of an OMTR, let's just talk a little bit about what you will need to do once you receive your registration. Upon successful passing of the OMTR exam, you will need to purchase malpractice insurance equivalent to $1 million US or Bermuda dollars per year before practicing, and you're going to have to submit the proof that you have your certificate, your malpractice insurance certificate, to the Bermuda Osteopathy Association. You will also need to submit proof of 15 hours of continuing education on an annual basis to BOA, and you will only be able to practice within the scope of a level 1 OMT. Okay, so this is what you need to keep in mind as you go forward. Okay, so we have reached the end of the study lecture, and I want to wish you all the very best on the BOBE OMTR exam. I wish you the best of luck. If you have any questions between now and the time that you sit the exam, please do not hesitate to shoot me an email, give me a text, send me a text message. I will see you all next week, Monday.